Start. Motor sensory disorder of nervous system. We have to refresh our information about sensory system and motor system. Sensory system is ascending system. It starts from peripheral. We have two pathways: lemnistic, which sensitive for temperature, vibration, touch, and it's come from receptors to the from this side, from the same side. It goes up, and in medulla oblongata and the hypothalamus is crossed to the other side till post central gyrus. Spinothalamic pathway, it's crossed the spinal cord from this side to the other side and up to the post central gyrus. These two are pathways for sensory system. Motor function, motor system is the opposite, it's descending. It starts from pre-central station, then to the anterior column of the spinal cord, then motor neurons to the muscle. About motor disorder, motor function disorder or movement disorder, we have two types: hyperkinetic, hypokinetic. Hyperkinetic, increasing of movement. Could be different types: atetosis, slow distal hyperkinesia of arm and legs. Chorea as a dance-like convulsions or a dance-like hyper activity of muscles due to a combination of polyglutamine. It could be hereditary, Huntington chorea. Tics, it could be in the eyes. Tics, slow, fast and short hyperactivity. Tremor in hand also, rhythmic type. And finally, seizures in epilepsy, and we can find there is three types of seizures: tonic and clonic. Tonic without pause, clonic with pause, and tonic-clonic mixed seizures. About the main mechanism for all of these hyperkinetic or hyperactivation of muscles, the main mechanism is is GBE, generator pathological of hyperaction of neurons. This is the main mechanism. Hypokinetic means increase movement of voluntary muscles. Could be two types. Paralysis means absent, no movement at all, and we add the suffix plegia to the end of the word. And paresis means decrease the movement of muscle. If paralysis is absent at all, so paresis is decreasing movement. Could be also weakness, paresis. Paralysis according to types according to number of extremities. We have monoplegia when one extremity, no movement. For example, one arm. Paraplegia means two arms or two legs. Paraplegia from both sides. Then hemiplegia means not from one half. For example, right arm, right leg. Tetraplegia, four extremities. Then according to muscle tone, the paralysis could be spastic paralysis, means that it's no movement, but we feel tone, we feel resistance. The tone of muscles is high. Spastic. Flaccid, when the no tone. Rigid means the hypertonus of muscles endogenous muscles. For example, flexible and anti-flexible muscles, both are high tonus. That's why this place become no movement due to hypertonus of antigenous muscles. This is according to muscle tone. According to place of localization or development, means paralysis, is it central paralysis due to problem in central organs, brain, spinal cord, or peripheral due to peripheral nerves? So paralysis could be central and peripheral. For example, I have two patients now. Both patients has paralysis of right arm, and this paralysis of right arm. How to differentiate? This is central or peripheral? Which one central, which one peripheral? Central paralysis, we see hyperreflexia. The reflexes are, there are reflexes. In peripheral, no reflexes. Reflexes, no. Tonus in central, hypertonus. We feel tonus, resistance. In peripheral, no tonus. And also, we can see, it's visible that in central paralysis, no atrophy. The arm is normal. In peripheral, atrophy means decreasing of size of the organ. This is about central peripheral paralysis. This in general, very fast about movement disorder. Let us speak about sensory disorder. Sensory is, as I said, is ascending pathways. Sensory disorder, according to the level, again, which level it's sensation disorder, could be cerebrum, the problem in the cortex, in the postcentral station. It could be also mental, mental bad feeling, like this. Brainstem means it's according to the stem of the brain, according to cranial nerves. It could be purely according to cranial nerve symptoms, purely. Brainstem. Spinal cord, problem in spinal cord. We can feel some pain in this side, for example, in muscle pain, spinal cord, spinal root, also peripheral nerves also. This is according to the localization. According to the type of sensation disorder, could be paresthesia. Paresthesia means as pain needles like. When we feel it in case of ischemia, for example, or in case of B12 deficiency, anemia. Dysesthesia, abnormal feeling. For example, in pain feeling, we feel high temperature, or high temperature, coldness, we feel something other feel. Dysesthesia. Hyperesthesia, increase. Anesthesia, absent of feeling, and we can feel it, we can see it in case of anesthetic drugs in operation, surgical operation. Purely absence feeling of pain, we call it analgesia. No feeling of pain. And the opposite, hyperesthesia, hyperesthesia, increasing feeling. I said hyposthesia, decreasing feeling, hyperesthesia, increasing. And hyperalgesia, high feeling of pain. This is types of sensory disorder. About pain, a few words. Pain is abnormal feeling of discomfort of something in body. For pain, we have purely this spinothalamic pain pathway for pain feeling. And we have to know that for pain, causative factors of pain is damage, high temperature, low temperature, cold, very cold, or very high, very hot, damage, inflammation. And for pain, we have mediators, pain mediators. For example, bradykinin, histamine, prostaglandin, lysosomic enzymes, ions of H plus, ions of K plus potassium, substance P, for example. This is pain mediators, which give us feeling of pain. In our body, we have anti-pain system. We call receptors of pain. They are localized everywhere except some places. In skin, we have receptors of pain. In superficial of bones, for example, we have pain receptors. We call it nociceptors. Then, in the opposite, we have anti-nociceptive system. We have some mediators of pain removal, for example, enkephalin, endorphin, enkephalin, serotonin, some hormones also, for example, vasopressin. It's as anti-pain, anti-nociceptor hormone. The pain scientists also discover that when we feel pain, when we have some damage, we feel first pain. First pain is very heavy pain and very acute pain. Then we feel deep pain. Then they discover that this nerve, spinothalamic pain nerve, it consists of two nerves. One is thin and other is thick. And then it's become clear why we feel two types of pain. And they give names for the two types of pain. The superficial acute pain, they call it epicritic pain. It's superficial, acute, localized pain. And second pain, deep pain, protopathic pain. They call it protopathic pain. It's deep, non-localized, spread pain, and chronic. This about pain. Also, you have to know that scientists discover about mechanism that lemnistic pathway is dominate on spinothalamic pathway. What does it mean? It means in this side, if we have pain sensation and we, for example, we doing vibration or we decreasing temperature, put some ice, we can remove pain. We can remove or decrease pain. Why? Because scientists discover that lemnistic pathway is dominate. Spinothalamic less dominant. It means that if we have pain sensation, it means that the pathway of spinothalamic is going. But if I stimulate lemnistic pathway in this area, in pain area, by putting ice or vibration like this, I will stimulate lemnistic. Lemnistic will inhibit spinothalamic pathway. Then pain will be inhibited. This is mechanism is discovered by scientists. This in general about movement and sensory disorder. Thank you very much.